In terms of reimbursement, does insurance cover the physician infiltrating the rectus and the soft tissue, or does because anesthesia can charge for the tap block, right? But is that included in our global? And then how much is it for the Expiril?
Well, I can tell you, Amy, it's been a real battle in that situation on trying to get Expiril in the past 10 years. And you're exactly right. Anesthesia can bill for a tap block, where when we do soft tissue infiltration, it wasn't billable and it would be a cost to the procedure. And that was an issue. So we used Expiril when we thought we really needed it, right? We didn't overuse it or misuse it. We wanted to be able to optimize the patient intraoperatively and postoperatively. So everybody has really good success stories with it. But the nice thing is, and I'm sure you all have heard of that No Pain Act that is going to take in effect in, I think,
Next year,
January 25, right?
January, right?
That's a huge breakthrough for patient exposure to Expiril. I think it was a bipartisan legislative bill that actually took a lot of hard work and a lot of education and a lot of conversations and a lot of interaction between pharma and people on Capitol Hill. And it was unanimously passed and will go into effect in January of 2025. And it was a preventable legislation that was aimed to really tackle this opioid crisis that we mentioned earlier. The good thing is now, and maybe you all, I might be wrong on this, but I believe that hospitals have to make it available to patients, and it can be a billable item. I think that's correct.
That's what I understand. Well, as it's in the HOPD setting and outpatient surgery setting, correct? That's where it's starting. So, yes, it needs to be available. And I know it's been a battle for some places some hospitals to get it. We had to kind of fight for it at our hospital before getting the anesthesiologists on board, and most of them are on board now. But this is going to be a huge step in the right direction because is Medicare, it's covering Medicare, Medicaid cases, then, usually private insurances will follow suit.
So it's mandatory CMS reimbursement now in January 2025.
Yeah, I was gonna say because my understanding is it's about $300, whereas probably comparable lidocaine, I'm guessing, is I don't know the exact cost, but it's like 20 or 40 or something like that. Yeah, so that's a huge win to get that covered, and the thing that we cannot, let's say, put a price on is how many calls you get to your nurse triage or to the physician about post-op pain issues. I mean, thankfully in gynecology, there's only 5 or 7 things that people will call about: bleeding, pain, constipation, discharge. Thankfully, not very common to get an abscess or other
Right.
things, but pain is a
Fever,
big
something. Yeah.
yeah, fever, but the pain component is a huge component, especially for those patients who have pre-op pain, endometriosis, fibroids. They cause a lot of discomfort. So, I mean,
Yeah,
that's
it is.
priceless.
Right.
It really it really is. It really is. And these and for the patients it's priceless because lidocaine compared to Expiril, there's no comparison. These patients, like we said, there are some patients that can have surgery and walk out the door and with no pain. That's rare. Majority of patients are going to require some sort of pain management. And with the Expiril and being able to keep them pain free for 72 hours makes a world of difference for the patient, because the lidocaine doesn't last that long. We know that.
So, can you tell me how you arrived at your journey of being Expiril users? Like, what about the patient experience? I think Steve shared his with the Bartholins, the no pain after that. I mean, I think we all have these kind of. I remember for the laser, for instance, for Mona Lisa, I was like, oh God, this is so cheesy. And then I had this patient who had lichen sclerosis, and we gave her topical clobetasol, and it didn't work. And then she it reactivated her herpes. Gave her tacrolimus and made her herpes worse. We gave her a bunch of Valtrex. the Mona Lisa, then we just started doing it and it helped her. She got plasma cell vulvitis and then it just reversed all the changes. So then I became a believer. But it sounds like the Bartholin's was the tipping point for Steve. How about you for you, Paula? What did you think about it?
So initially at our hospital, the only surgeons that could get it were the GYN oncologists. They were using it. They started using it, and I had talked to a couple of them, and they really made it difficult for us to get it. We're the lowly OBGYNs, so to do it for our C-section patients or hysterectomy patients. And finally, I was able to talk to admin, and I had, and the GYN oncologist really believed in it because it was working so well for their patients. So they jumped on board and helped us to allow us to get it on labor and delivery. The first time I used it was on a C-section. And I talked to the patient and I said, this is what it is. I explained to her what it is. I said, I've heard great things about it. I've had, some colleagues who've had great outcomes. What do you think? And she's like, let's do it. So I had anesthesiologist who was wonderful and who was, all about the tap blocks. And so he did the tap block and I said, okay, I want you to let me know how you do and how you're feeling. I went and rounded on her in the morning and she's a repeat C-section. So she knows the difference between, with and without Expiril. So I went and rounded on her in the morning and she was up, she'd showered and I said, how are you doing? And she says, oh my gosh, I feel amazing. She says, this is so a 180 from my last surgery. She said, last C-section, they had to force me out of bed. I was in so much pain. And she said she went home with narcotics and she really doesn't like the way she feels on it. Most people don't, and she was so happy. She said, I don't need anything. I just need some Motrin. I'll take some Motrin home and I'm good. And that really sold me on it. And so then I progressively, then we were able to get a team together at the hospital to get Expiril on board and started using it on all of my C-sections. And then I started using it on my GYN cases. And I've had nothing but positive experiences with it. So